Hi, I'm Susie Davis. I'm the practice manager here at Surrey Total Health. Today we're going to be talking about children and the coronavirus. I'm a mum with a daughter of a 6-year-old and I have some questions. I'm joined today with Dr. Barty, our paediatrician, and Mr. Unithan, who is our consultant orthopaedic surgeon. Hi both.
Hi.
So I just want to start by asking you, Dr. Barty, what are the symptoms presenting themselves in children for the coronavirus? Are they different to what you see in adults?
Yes, so the symptoms in children are very similar to adults. However, most children will have a milder illness, but they are also more variable. So some of the symptoms, so the common symptoms in children, fever, dry cough, sore throat, and other symptoms which are more noticeable in children compared to adults is tummy pain, diarrhea, sometimes rash, which are not usually seen in adults. So although illness is relatively mild, but the symptom can be more variable in children.
Right, okay, thank you. And what should I be doing to keep my child well if I'm treating her at home or him at home with symptoms for the coronavirus?
Yes, so most children can be cared at home because their symptoms are mild and they recover without any um, other help. And so they can be looked after quite well at home. So making sure they are well hydrated and they are given the balanced diet as we normally do. And they also take paracetamol if their temperature is high or they feel unwell, like symptoms of muscle aches. Uh, However, we will advise that parents should avoid using medicine like ibuprofen because there is some research show that it can make the symptoms worse.
Yeah, okay, thank you. And what should I be looking out for in terms of symptoms worsening and when I should seek advice or be taking my child to A&E?
Yes, so most parents are quite good at recognizing when their child
Yeah.
is unwell or significantly unwell to seek further advice. So the children who develop very high fever, they develop shortness of breath, and they look unwell. They are not able to keep with the fluids or they are vomiting, significant diarrhea, and generally speaking, they don't look very well or they're not up and about. In that case, they should take every opportunity to seek further medical advice, either by ringing 111 or they can talk to their GP on the video consultation. And it's still quite worried. They can even bring the child to the A&E department to their local hospital.
Okay, thank you. And so I think that kind of answers my next question. But so if am I able to go to the hospital with my child?
Yes, we would recommend that one parent or one adult should accompany the child. Obviously, child will require reassurance, and younger children will be frightened in the new environment. So yes, there is no problem.
Is it very strict that it is just one parent at the moment?
So we like child should be accompanied by one parent to reduce the risk of other people either catching infection or passing on to other people. So recommendation is that child should be accompanied by one parent or one adult.
Okay, thank you. And if one of us is showing symptoms, does it need to be the person who is well who accompanies the child?
Absolutely, yes. So any person who has a symptom or suspected coronavirus, they should stay at home in self-isolation.
Okay, thank you. Okay, and there has been some information in the news this week around cardiac inflammation and abdominal pain Could you talk a little bit about what to look out for in that situation, or how common this is proving to be?
So yes, we've seen these reports not only in the newspaper, but there have been report cases from both America and Italy, and we have seen patients even in our own unit. Children who have symptoms of coronavirus, whether they are positive with the swab or not, they develop quite significant illness. And some of the other symptoms like rash, tummy pain, and even other organs involved like kidney or liver, and they have become quite unwell and required intensive care. Luckily, this condition is very uncommon. We do not know much about it, and most children still recovered from this like they have with other illnesses. So yes, I think if parents are worried about that child is very unwell looking, they must seek further medical advice.
Okay, and I've heard mention in the news about toxic shock type symptoms. Are they very similar to the symptoms you've just described, or are there different things I should be looking out for?
So yes, we've seen children presenting with toxic shock-like syndrome, which basically mean high fever, rash, rigors, and involvement of other organs. And Kawasaki is also been mentioned, which again is a condition of inflammation of small blood vessel, and it is usually triggered by infection, and it could be viral infection, including coronavirus. And the symptoms and signs are again very similar. They have a high fever, sore throat, skin rash, and they can develop symptoms of diarrhea and inflammation of the heart. These children can become quite unwell, but they still recover uh, faster than many adults.
Okay, thank you. Okay, so Dr. Bharti, in the instance of children having things like asthma or diabetes or problems with their immune system, is there different advice for children who are in a more vulnerable category?
Yeah, so most children and adults, we have advised them to stay at home. Prevention is the best treatment. However, those children who have underlying medical condition like heart problem, deficiency of immune system, or diabetes, I think they've been asked to have a self-isolation for several weeks. In fact, some are asked for 12 weeks. And the reason behind this is because this is a vulnerable group. And if they develop coronavirus, the illness will be more severe. So to avoid such situation, it is better to be at home and avoid any contact with people who might have coronavirus.
Okay, thank you.
Thank you.
Thank you. And finally, a question for you, Mr. Unithan. If my child were to fall over at the moment, should I take them to A&E as usual? What should I do?
So most of the kids' fracture luckily heal well without any residual problems, without any surgical intervention. So
Okay.
my advice would be if you can cope at home with ice, elevation, painkillers, and see if the pain gets better, then no need to bring your child to A&E. But having said that, if you have any doubt, please call your GP or come to A&E, because most A&Es have now a COVID-free zone where you can pass through without having interaction with the rest of the hospital. Certainly in the hospital where I work, in St. Peter's Hospital, we have a clear defined area where you come in, have your X-ray or not have the X-ray, have examined by a senior clinician, and you go home.
Okay. Thank you very much, both.
Thank you.